Let's move on to the procedure. Make sure you always follow your facility's policy. Prior to starting the procedure, make sure you don gloves. Use scissors if you need to clip any hair. This helps to let the tape hold more securely. It also assists you in visualizing the veins. You don't want to do shaving because shaving can cause little abrasions that can contribute to infection. You need to clean the site with a cleansing agent in a circular fashion from the area that you're going to stick in circles all the way out. Allow to dry 30 seconds. You're going to use whatever your facility policy requires, whether it be alcohol and betadine or alcohol and BZK. The alcohol defats and cleans the oils off the tissues, and then the disinfectant part is either the betadine or the chlorhexidine or whatever your facility requires. Ethyl alcohol or BZK, benzalkonium chloride, can be used for those clients that are allergic to betadine, and allow it to dry 30 to 60 seconds. Always clean using concentric circles. Clean from the center going outward. When you're going to start an IV in the hand, you want to make sure you use a C hold. As you'll see, they're holding the hand, using their thumb to form a C. This helps stabilize the vein, and it should be used on top to draw the skin taut, and you can rest the rest of your fingers underneath the extremity. You want to make sure you hold the catheter between your thumb and middle finger. Use your index finger to place on top of the flange. That way you know the bevel is up. That way you can push the catheter off the needle. You need to insert about 15 to 30 degrees. And this is a nice way to remember. It's called BLATS. You want to make sure you approach bevel up, level to the skin. Access the vein. You get the flashback. Advance the catheter. Place a 2x tube beneath the hub. That way you may only have 1 or 2 drops of blood when you go to connect the IV tubing. You want to reach up with the same non-dominant hand, pop off the tourniquet because its job is done. And your S is the system. Attach your tubing. If you're going to attach an intermittent device or an extension set, make sure you do that when you set up the tubing. Make sure you pre-prepare it by taking a syringe of saline and pushing saline through it before you connect it, or a heparin lock, whatever your facility requires. Some complications of IV therapy can be an infiltration. This is where there's leakage of IV fluids out into the tissues. The site will be pale when you press on it. There'll either be low flow or no flow in your IV. There's generally pain at the site, edema at the site. Some individuals can't tell you there's pain at the site. They may have a disease process called neuropathy or something where they have decreased sensation in those hands. Some prevention methods are: select a site that's not mobile in a joint. Select appropriate size catheter based on the solution used and the client condition. Make sure you properly stabilize the IV by putting it on an arm board or taping it, putting in a tension loop. Only use restraints in accordance to agency policy. Some further complications of: if you suspect an infiltrate, you need to stop the infusion. If it is a vesicant or something that'll break down the tissue, such as potassium items that might be in there, make sure you notify the physician or the healthcare provider immediately. You want to elevate the extremities. You want to make sure you do neurovascular checks on the site. Check their fingers for circulation, touch, feelings. You also want to look for phlebitis, which is inflammation along the vein. It'll be red, it'll be warm, hard. Any type of pyrogenic reactions usually occur within a few minutes to an hour after you've started the IV therapy. If in doubt, always stop the infusion. You want to make sure that the bag never empties and the tubing never empties, so you won't have an air embolism. Speed shock can happen if IV flows too quickly. Breakage of an IV catheter. If in doubt, you've had difficulty inserting the catheter, just remove the whole thing. Don't try sliding the needle in it back and forth. Circulatory overload is when the patient has received too many fluids and their heart just can't tolerate it, especially patients that have a history of congestive heart failure. Thrombus, you can get a blood clot at the end of the IV catheter as well. Thrombophlebitis, there can be a blood clot in the vein near or around the IV catheter. It can become inflamed, swollen, painful. This is a good example of a complication of IV therapy. It can cause some bruising. For example, keep in mind it could be an individual that's on aspirin therapy or blood thinner therapy. This is not a normal picture of an IV site after the IV's been discontinued. This is an example of a complication. IV was started in the hand, and apparently there was an infiltration. You'll see the swelling in the fingers and the tissues are surrounding the area. This is obviously an irritating solution. It could have been something as simple as potassium in the IV. You see how it ate up the tissue, macerated the site, and that's a terrible wound they have left behind. Another complication of IV therapy can be infection. We all have bacteria on our skin, and sometimes just sticking a person and putting a foreign object in there gives it a site for infection, and the patient can be contaminated with their own bacteria or bacteria of others. This is an example of a complication of infiltration. The IV was started in the hand. You see the hand is swollen, the fingers are swollen, the arm's swollen, the ID band is being constrictive. Anytime a patient complains of pain, swelling, please check it out. Make sure you evaluate the site. The IV will need to be started again in another arm, and this site needs to be treated. And documentation is extremely important. Make sure you check the patient to see if they have a fever. This is an example of a fluid setup with a maintenance bag and a piggyback bag. So maybe an antibiotics or something was given in the little piggyback bag. And once it's full, the maintenance bag will take over after that. So you don't have to worry about it running empty. This is an example of an IV setup diagram. You have your drip chamber that's connected to your IV bag. There's an ejection port on this type of IV bag. There are injection ports in the IV tubing. You have your roller clamp, or maybe it might have a slight clamp on it. This is an example of IV additives to fluid setups. For example, the compact vial will have a ring top. You can slip it off. Slip the ring top off the IV fluids as well. The next step is to add the additive bag down into the plug, press it in, and it will release whatever is in your vial. And then the IV is ready to be spiked and hung. This is an example of an IV fluid setup with a burette. These little burettes are usually used for specific reasons. For example, let's say the patients get an IVs at a low rate, and then periodically they'll need to get vitamins or something. They can fill the burette, so think of the burette as like another little mini IV bag. They can add the vitamins to the burette and then just let the medication flow through, and then the regular maintenance bag will take over after that. This is an example of an intermittent lock access to deliver medications. When you go to start an IV, I always suggest that you add an extension set with the intermittent lock adapter to it, so that way you're not ruffling around where the IV site is and accidentally pull it out. IV boluses should be given by the licensed personnel and according to your facility's policies. Again, you'll see there's a IV tubing connected to this catheter site right here, and you have a needleless system closest to the patient so that you can administer medications. Make sure you pinch off the tubing like the healthcare provider is in this picture here, so that way it doesn't back up the tubing, whatever medication that you're giving. This is an example of an intermittent lock set connected to an IV catheter. This will need to be flushed at least once a shift, and it'll be flushed according to your facility's policy every 8 hours, usually saline. sometimes heparin, depending on what it's being used for. These can be needled systems or needleless access systems. The needleless access systems are safer to use. There is new equipment to help you find veins. They're usually called vein viewers, vein finders, that type of thing. You put a sheet on the patient, you'll shine a little light on it. It looks like a little black light, and it'll show you where all the veins are. Makes it easier to access. The National Infusion Nurse Association suggests that you use some type of control device on all IVs, preferably a pump or control device such as this. These control devices here are calculated in milliliters per hour. This is an example of a pump. This is a dual set pump here. You can run IV fluid on one side, calculate it, put it in, identify it into the machine. It's like a little mini computer. You can also calculate one on the other side, and it will know which IV it's flowing because you can name it and title it. If you need one to stop and one to pick up after it, you can put that in your IV pump and it'll do that for you. PCA devices are patient-controlled analgesia devices. The healthcare professional will put the syringe into the machine, give the patient a little control device, and they can press it, and it would administer pain medication or whatever medication it is on the patient's request and not on the healthcare provider's request. So the patient's only getting it when they need it. This is an example of another kind of pump. It's a syringe pump. We'll place the syringe outside of the pump itself, but you'll put all the calculations into the pump. You have a syringe plunger, syringe with the medication in it. You'll connect it to IV tubing that belongs to this pump, and it'll pump, and you'll watch it slowly administer it like an IV push. Again, this is just another example of dual-sided pumps or single-sided pumps. Again, the tubing that belongs to the pump can only be used with the pump and not with another pump. Again, these are like mini computers. You can go in there and label what they are, tell them at what rate you want to give it at, read how much has actually been infused, read how much that's left. This is just an example of various types of poles. You can have dual eye pole. This is four-way pole, rolly poles on machines, on IV pumps. Just various assembly times. You'd use whatever's in your facility. This is a central line. It should be accessed by licensed personnel. I want you to think of this IV as a long IV that empties into a giant vessel, which empties into the right side of the heart. It's a sterile procedure to change these dressings. You should be in a sterile mindset. Every time you access this, I want you to think of this as it's directly delivering materials to the right side of the heart. The IV tubing gets changed just as frequently as it does for a peripheral IV. The dressings get changed according to your facility, probably once a day. According to the Infusion Nurse Association, a chlorhexidine disc should be placed at the insertion site of the central line during every dressing change. This is another example of a central venous catheter. This is a tunneled catheter. You'll see the little clamp up above. That way you can clamp access off and on. This should be accessed by a licensed person and dressing changes by a licensed person as well. I do want to note that at that particular site, as you can see, this was just done for demonstration purposes to show you how the biocclusive dressing goes on. There needs to be a chlorhexidine disc placed at that site. Sometimes we'll get patients who have dialysis devices, either in their groin, in their leg, or up in their chest area. Again, think of these as these are central line devices here, and they must be handled in a sterile fashion. A licensed personnel access these devices. They shouldn't be used for anything else but dialysis. This is another type of IV. It's inserted by a qualified individual, healthcare provider, specially trained. It's called a peripherally inserted central line. Even though it's down in the arm, it still goes into a central vessel, which will empty out into the heart. Again, you need to access these in a sterile manner. You'll notice that on this device right here, someone's placed an extension tubing, which is wise as well, and it has a little clamp that can be clamped off. These PIC devices, they also always need to be checked to make sure they're patent. So before anything's put in there, when the site is being checked, you need to take some saline and withdraw to make sure some fluid and blood comes out and that the site is patent before you use it. And again, a licensed personnel will be doing this. Like with any other procedure you do, the documentation is one of the most important things that you can do. You need to make sure you document the date, the time, the initials, the gauge, the number of attempts at insertion, because sometimes you can't get it right off the bat. I suggest you try at least twice, and then you need to walk away and let somebody else do it. Describe what the site looks like. Are there any signs and symptoms of infiltration? Is there any redness, any swelling, any signs of infection, any signs of fluid leaking? How did the client tolerate the procedure? What solution is infusing? Name it. At what rate is it going?